when both of them are going together and then we have acclimatized to their speeds, and we are feeling that we are doing justice to both wives, the third wife has emerged. That is a minimally guided or MR guided treatment or MR guided therapy. And again, Dr. Sreenivas has done the game changing and path breaking role. He played a major role in that, introducing the MR therapy in the form of MR guided ultrasound. I would like your comments in that.
Oh, that's something. Okay, that's something everybody should really know, and I think you should get into. As a radiologist, I would strongly advise all of the younger guys to really get into this in a big way, because MR guided focused ultrasound surgery is, as Ram put in, is a game changer. Now we have moved from the diagnosis to therapy. Therapy is treatment. So you're not only the guy sitting on the table and telling the referring guys that what is wrong with the patient. Now you're telling him what is wrong and you're treating it. Of course, interventional radiology does exist, which is the vascular where you put the catheter inside. That's an invasive interventional radiology. Now from that, we have entered into this very exciting field of non-invasive interventional radiology, where this MR guided focused ultrasound, you map the tumor under the MR guidance and destroy the tumor with the help of the high intensity focused ultrasound. We're using it for uterine fibroids right now, adenomyosis of the uterus, the bone tumors, the prostate cancer, and this is just the beginning. This is the tip of the iceberg. What we are planning to do is breast cancers, and more excitingly, we'll be using it for the brain, the functional neurosurgery. Today, you have a huge population of Parkinson's, you have a huge population of people who have got intentional tremors, they are either on the medical therapy for a long, controlled or uncontrolled, and there are some surgical like DBS and subthalamic nucleotomy which are available, but of course they are invasive again. Here you can do it without even doing a burr hole. With MR guided focused ultrasound, you can just put a flat ultrasound on the head, no craniotomy, no burr hole, and you can produce a lesion in the brain and cure these patients. It's going to be very, very exciting, trust me. It's going to be very exciting.
You can produce the lesion exactly in the basal ganglia.
You can produce the lesion. It's a sub-millimeter precision. Where you want to produce, you can just focus it and then produce a lesion. And you can get rid of the intentional tremors. It's really fantastic.
It's brilliant.
Oh, it's brilliant. It's absolutely brilliant.
Because it's a frustrating disease to have, Parkinsonian or Parkinsonian syndromes. Where you get
I only observed it, yeah, I can kind of relate
if you see the
yes,
it kind of guy, you'll realize
I know
how difficult it is.
It's true, yeah.
And it's a progressive disease.
Yeah, so there is a cure in the offing, isn't it?
And DBS was not very comprehensively understood, because the symmetry of the symptoms on right and left, which will respond first, which may not respond, and it is and it was invasive.
And DBS basically is a deep brain stimulation, where you have to do the burr hole. You put an electrode inside, put it into the nucleus, and stimulate that with a battery. Okay. Yeah. And in subthalamic nucleotomy, what you do exactly is produce a lesion by putting a probe inside. Now with this MRGFUS, you don't have to do that. No invasion. You can do exactly what is being done, even without touching the patient. Which is super. Isn't it exciting? It's really, I am very proud to be a radiologist. Trust me.
Sir, now this coming to excitement and kick in the stomach and passion. Now there are three things which the radiologists of your era and to some extent my era, that is the generation wise, we are identified with these symptoms.
Absolutely.
I don't know whether it's a disorder or it's a problem, but I really enjoy. Even now, when I see a new gadget in the department, I will put my hands onto it, get the parameters, get some images onto it. But now, when I look at the younger generation, now they are not excited at all. Now, that is my perception, but perception is the reality. Right. So my perception is their excitement levels are not matching to my excitement. Is it that I have some obsessive compulsive disorder? Is there a personality problem for me, or is it this whole the game is changing as far as generations are there?
No, basically, Ram, you are like a raw one. You're a big guy. So your passion is also unlimited. Now, I think your passion, though it's unlimited, is very, very fruitful and justified, and it's very focused. To a point, I agree with you. The kick which we got, the excitement, I can't use that other word, which we got by doing these techniques, getting involved into that, developing them. To a certain extent, I agree that the younger generation doesn't seem to have the same kind of an excitement. Whether it's a commerce which is making the difference, whether there's a war going on between science and commerce, I don't know. But what you say, yes, to a certain extent, sure. Not it applies to every single individual, but larger percentage are less excited. They seem to study the modality more from passing the exam and then trying to establish in the practice, right, rather than developing it. Of course, I have seen you the way you used to do. Oh, it was crazy, absolutely. I mean, there are very few people in India who can match your passion into developing the things. But true, I think the youngsters should be more focused. Sure, you should study for exams, no question. You should study to settle in the life, no question. But the development of the modality will only happen if the radiologist is really involved. Otherwise, he does the hands-on. It's not that, there is a tendency nowadays that most of these are operator dependent. That's a new word. And the operator, by definition, is becoming a technologist and not a radiologist. And that's a sad thing. Because actually with the development of this kind of a very fast acquisition, both in CT and MR, I think there is more need of a radiologist to be sitting at the console rather than a technician. Technician cannot do justice to these modalities if you leave entirely everything to just the tech. It has to be the doctor. It has to be the radiologist. And this message is very important. They have to get involved into this. If they don't, I think they will, A, will be suboptimally utilizing all the technologies, and B, they won't be good in the subject. And probably, for all you know, they might leave this good specialty which is coming up to some other specialties. Yes. Because as we all know, neurosurgery and neurology has officially introduced interventional neuroradiology as their training course. So eventually the gynae guys will get MRGFUS. The uro guys will get to, because we are treating prostate cancers. Onco guys will get into these newer things. And if we are not passionate, it will go away from our hand, positively. That goes without saying.
Superb message, sir. Superb message.
Yeah,
it's very important that we need to look after our bread, our profession.
Absolutely.
So excellent, sir. Excellent thoughts.
Thank you, sir.
Yeah, so Dr. Desai, thank you once again on behalf of Dr. Ram and me for joining us on this show. You've shared your experience, your wisdom for all the young radiologists out there. Thank you once again.
Thanks for, it's always nice to be a part of whatever Ram does.
Yeah.
Thank you, sir. Thank you, sir.